good morning everyone, and thank you for joining today's online training. My name is Bella, and today I will be introducing Mitelier, which is our PLLA based collagen stimulator. This session is designed not only for clinical understanding but also to help you confidently position and explain the product to your patients and clients. And to begin with, before starting, I just want to mention that I am not a doctor. I'm not a doctor. So, um, first, let me briefly walk you through today's agenda. You will start with a product overview and then followed by key features and how Mitelier compares to other products in the market. And then we're going into preparation and injection protocols, which are very important to achieve optimal results. And finally, we will cover aftercare, management of side effects, and cautions. So starting with Mitelier is a base PLLA, poly-L-lactic acid, which is well established, biodegradable, and biocompatible material. Unlike traditional fillers that provide immediate volume, this product with this ingredient will help you by stimulating the body's own collagen production over time, which means natural results. So they will be much more long lasting and it will improve the skin quality and volume. Regarding the history of PLLA, this is not a new ingredient. It was first used in France in 1950s and later widely adopted in surgical sutures and then expanded into orthopedic and aesthetic applications. And in 2009, this ingredient has been approved by FDA, so that's where Sculptra comes in for the aesthetic use. And from 2009 until now, there's a lot by variety products based of PLLA ingredient, and that also includes Mitelier. PLLA is derived from plant-based sources such as corn and starch and potatoes. Those make it both sustainable and biocompatible. And when you once inject this ingredient into the skin, it forms a biodegradable structure that in overtime it naturally breaks down. So this is much more like the chemical is a chart that shows you chemically how it happens. And importantly, PLLA already being widely used in medical sutures, which further supports its safety and stability. So the medical applications. Now let's go through how Mitelier actually works. So the mechanism of action. First, the PLLA particles that are injected into the deep dermis of subcutaneous layer will create a mild and controlled inflammatory response inside, which that would actually activate the fibroblasts inside the skin. And these fibroblasts then begin producing new collagen, which is type 1 and type 3. And this leads to gradual improvement to skin quality, elasticity, thickness, and volume. At the same time, PLLA will slowly break down into water and carbon dioxide, and it will be naturally eliminated from the body. So these, even if they are not in the body, it will allow to continue stimulate collagen production that will approximately last for over 2 years. So once again, to summarize how the mechanism works into the body is once you inject PLLA or Mitelier into the skin, there will be a mild inflammatory response which will create fibroblast stimulations, so they will work out to promote out collagen production, and then you can see the results, which will improve the skin volume and elasticity. Now, I wanted to also talk about the futures and any comparison with other products. So I think these are the four main um, points that you can say. So first of all, it's very biocompatible and biodegradable. It has microparticles measuring 30 to 60 micrometers. PLLA is FDA and CE approved ingredient, and it has a long history support of long-term safety. So these are very four important points that I wanted to mention. And if you see in this chart, it says uniformity of particle size. This is a very important and strong point of our product because these particles are highly uniform in sizes. So as I mentioned in the first slide, 30 to 60 micrometers, you can see this chart that Mitelier has around 30 to 60 micrometers in total as a test. And if you don't have even particle sizes, that increases the risk to have complications like granuloma or nodules, or not severe, but you do have some pain. So that means that this uniformity of particle sizes, these small sizes of particles, have to be very uniform, which also will be uniform distribution that will reduce this risk. So this is a very important graph that you can take in note. And I would like to emphasize that this chart is internal use only, and it should not be used as marketing. So you can have this chart and you can share to your clients, but please don't spread it like marketing. So yeah, you can use this. And now I wanted to talk about the preparation and protocols. So basically, this is our basic dilution. First, you use 7 cc of saline plus 1 cc of lead, okay? And then this product has to be at least 3 hours ready or diluted before use. And it's important to mix very gentle and not aggressive. So if you do, you can shake it with your hand, but don't do it too hard. And also, sometimes you may notice that the product does not fully dissolve, but this is very completely normal and expected to be seen. So don't worry about seeing some particles not dissolved. And then I wanted to share some of our cases from one of our experienced practitioners from France and Poland. First, I want to mention about our French doctors, the way they dilute their products. So usually what they do is they have their vial of Mitelier, they put 8 cc of saline and 1 cc. That's the total amount they use. But before anything, they put they put 8 saline cc in the Mitelier, and then the lidocaine as well. They make it sit down on a warm water of bowl. So they don't put all the vial, of course, inside. They just put the half. They wait for 5 to 10 minutes. They take it out, and what they do, they shake it a little bit, and then they make it upside down. And then again, they wait 5 to 10 minutes upside down, not warm water, and then they lift it up again, shake it a little bit, and it'll be ready to use. So this tip has been used for a lot of our French doctors. So this protocol, you can use it as a tip if you experience trouble with diluting Mitelier. And then we also have another preparation method from our Poland doctors, this protocol is pretty similar to our basic protocol, but we still wanted to share. So usually what they do is they will add 5 cc of saline into the Mitelier vial, and they will shake it a little bit. They don't like using machine, so they shake it a little bit and make it rest for 1 or 2 hours. And after that, they will add more 4 cc of saline. After the 2 hours, 4 cc of saline, shake a little bit, put lidocaine 1 cc, shake it, and they will also wait they will wait again, and it will be ready to use. So the total volume will be 10 cc. Okay, so these are some of the tips I really wanted to share, because I think it will be very helpful for people starting to use Mitelier, or for people who have expected some problems doing the dilution. And in this slide, it shows how we do the dilution with our roller mixer. So usually we add at least 3 cc of saline, shake well for 1 minute, and then we add again 4 cc of saline. And you can use this roller mixer for at least 3 to 72 hours. If you have to be fast, at least 3 hours will be very good to use. And when you finish using the roller mixer, you take out the vial and you add 1 cc inside of lidocaine. And after that, it will be ready to be used. So we do recommend roller mixer if you have one. It will be very good to dilute the product. So this is an example of properly hydrated Mitelier. You can see that the PLLA particles are very uniformly distributed in the vial and adhere to the surface. Now, I wanted to mention some precautions before injection. So before treatment, you need proper patient selection, which is essential. You should check for contraindications such as autoimmune diseases or bleeding disorders. And it's also important to manage expectations, like some patients do have to understand that this is not an immediate effect, it's gradual effect. And always review medications, like avoid recent energy-based treatments. We recommend using these energy-based treatments 2 to 3 months before prior Mitelier or after. So that is our recommendation. Also, talking about injection techniques for Mitelier, you should be injecting the product subcutaneous layer and control technique. Also, common methods include like fanning and cross-hatching. So this procedure and this one. And it will actually depend on which area of the treatment you are doing, but yeah. Also, the product is typically injected into retrograde technique to ensure even distribution in the area. And this treatment is usually 2 to 3 sessions at 4 weeks interval. So to say it easy way, you can do 1 session per month, and we recommend at least 2 sessions or 3 sessions. So that would be like 2-3 months for the best results. We also think that the aftercare is very important, especially we recommend doing gentle massage in the treated area using your fingertips or palms in a circular motion. Later on, I will put a video and you will see our doctor doing the massage after the treatment, and you can apply very light pressure and think of it as a lymphatic massage. And just always make sure to not miss a spot from the session treated area. Okay, and another post treatment and another care treatment will be, we strongly recommending the 5-5-5 rule, which is massage 5 times for 5 minutes for 5 days, and this helps in prevent particle aggregation and reduces the risk of nodules. So we recommend the 5-5-5 rule. And as you may know, patients may experience temporarily swelling and bruising, which really resolves in a short time and natural. Regarding the side effects, the most common side effects are swelling, bruising, and mild pain. So these are generally temporary and resolves in a few days. If the swelling is very bad, cold compress can help reduce it, and yeah, it will help reduce it. And some cautions that we specifically want to mention is to avoid injection in blood vessels, and especially in high risk areas, and do not overcorrect in one session. So like if you've done it, just don't overcorrect it, because PLLA works gradually, so there's no need to. And high dilution and deep injection is very recommended for the best results. So now I'm going to go with the questions and answers. And these are some of the frequent questions we've been asked during the time, and I just wanted to share with you guys. So could it be hydrated 30 minutes before use? Actually, yes, we do recommend using, we do have some videos of how to dilute the product in 30 minutes. However, we recommend mixing with a roller device if you're doing it. But the best results will be probably doing the dilution 3 hours prior the treatment time. And how long after hydration should it be used? Again, you open the vial, you made the dilution and everything, but your patient didn't came. This diluted vial could still be in use within 72 hours, so it will be totally fine if the patient comes in between that time. And can it be used even if there is sediment? As I have explained, it is very normal to see the sediments, and you don't need to really worry about it. It is safe. And could this be mixed with other products? We don't recommend it actually, because this is a product that goes subcutaneously in the subcutaneous layer, so we don't recommend. And what is the difference from Sculptra, which I really mentioned it a lot? The particles uniform size is the advantage, we like to say, because it has less likelihood, less reduces nodules, and that's a really big advantage. And can it be used on the body? So this is not official, it's not been approved to be used on the body, but we do have some experienced doctors that has been using Mitelier to the body by diluting at least 15 cc of the total product. So I wanted to show some before and after videos of the use of Mitelier. As you can see, she has done 3 sessions, so 3 months, with the nasolabial fold. In the forehead for 3 sessions. Again, you can see how much the volume have been recovered in this side. For only 2 sessions, you can see how small lines are seamless, and you can see more volume in the glabella. You can also see in the marionette line This also has been 3 sessions. This patient and this other patient actually were one of the patients of our seminar we had last month with our KOL, and they only did, of course, 1 session last month in the nasolabial fold, and this is the after picture we received. And this patient as well, she did a nasolabial fold treatment. So actually, I wanted to show you guys our video of the seminar that will include this patient doing the procedure to her, and it will take around 5 minutes, but our doctor will explain some of few important key regarding the treatment, so I hope you can watch it.
Minimal invasive and minimal swelling and bruising too. I go outer line of the so-called face, because for the ladies or even men, they can just cover, even there's a bruises outer side, they can still cover it. And the point, thinking about the cannula length, I can approach almost everywhere to the area that I showed in the 7 lifting points. So with the one angle, so I almost can do everything. So first I'll do go nasolabial. 네, 여기에서 이렇게 들어갈 텐데 들어가는 건 괜찮아요. 여기 끝에가 신경이 하나 있어요. 그래서 여기에 딱 마주치면 시큼할 거거든요. 그거만 참으시면 괜찮을 거예요.
He was explaining now to the patient that there are some nerves nearby.
PLLA on the nasolabial, right? One vial, 10 cc. 네네. But the protocol, I think, depending on your clinic style. When the puncture, I know because of the stress on the bottom that I'm at a subacute area. The reason why I know, because it's moving so quickly like this. 조금 불편하실 거예요. 여기까지 가야 이제 아파요. 하나, 둘. When I meet here, I already told her that you will feel pain because there's nerves there. But from the clinic side, or doctor side, if she frown, then I know I'm at the good target. And this is subacute, so I backdraw and then go for the deep, and this is bone. So cannula down. Bolus, just maybe 2 cc, I would say. And then I can see that it's some they're augmented, and then as I mentioned, I draw it back, change the layer again, a bit of superficial. And then I treat just the lines to make sure. That's it. And no overfilling at this area, not to make any wrong one. Of course, it's the nasal regions. So, but that's why I'm going with these lines because it's parallel to the facial artery. So I was, from my experience too, going on this area, like parallel to facial artery, was the least dangerous, the approach I was thinking. And afterward, I haven't met any like super. I don't use the, one time I was brave to use needle injection at that area. One time that I had an injury too. 네. Injury means bleeding a lot, but maybe there was not the worst case, but I hear by putting the injection here that it goes up to the occlusion to the eye thing. I don't want that. So afterward, All the filler only biostimulator. I changed the cannula. Only lip, because of the very subtle design, I used the lip one. But other than that, I only use cannula. Same thing. I know it is there, so I drop it a bit and
So you go down into the
bone
bone.
touch. 네네. On the bone.
On the bone.
잘 들어갔고 이제 아까처럼 살짝 레이어 바꿔서 so I change layer once again. Just slightly for to fill up the lines. That's it. Now no crossing that. And then always with even filler or any biostimulator afterward, try to massage here.
Okay, thank you very much for your attention. And I hope this webinar really helped you out in answering some of your questions you might have from the product. And if you have any further questions, you can send an email to me or to your sales representative, and they will pass out those questions to us. And we will send these questions and happy to discuss them with our key opinion leader, and we will make sure those answers will be answered and sent back. So thank you once again for your time, and we hope you enjoyed today's session. Bye.